The federal government has approved Medicaid expansion for the state of Maine. Now, you might remember 2 Novembers ago, the people of Maine voted for Medicaid expansion on their ballot. It did not get implemented. It was up to then Governor LePage, who refused to carry out the implementation. As you can imagine, there was a lawsuit that followed saying the people have spoken. It is part of the procedure that this now be implemented, but then Governor LePage held up that implementation. So a lawsuit was started to challenge whether or not that implementation should be immediate effective the day after the election or as specified in the paperwork. And in the meantime, there was another election and a new governor was elected to the state of Maine. That new governor ran with Medicaid expansion being implemented as a priority, with a priority on health care for the state of Maine, and that was successful. So as soon as the new governor was elected, her first day in office, she signed an executive order that said, let's make this Medicaid expansion a reality. Instantly, about 16,800 people were added to the Medicaid roster in the state of Maine. A lot of people got access to health care and coverage for the first time. Then it's up to the feds to make sure that that is following the procedures. They still had to review the Medicaid expansion and approve it, which they did on April 3rd. And they said, yes, keep adding people to the Medicaid rolls in the state of Maine, but actually you should have been doing this since July, the effective date of that ballot measure, July of 2018. So the federal government approved Medicaid expansion on April 3rd, and they said, and go back retroactively to July of 2018 and catch all those people that should have been enrolled in Medicaid had this been implemented properly. This is a big win for the state of Maine to make sure that coverage can be expanded to what they project to be up to 70,000 people. Some estimates are actually saying we could really surpass that 70,000 number because the state of Maine has been enrolling almost 1,300 people a week who are eligible for this new enhanced Medicaid program. And this is a traditional Medicaid expansion, which means the federal government is picking up at least 90% of the cost of Medicaid expansions in this state. So the cost is about $800 million through Maine's fiscal year 2021 that the feds will be paying, and the state share is a little bit closer. Some estimates say between $50 and $60 million a year. So it's a great boost, great federal money coming into the state and improving the health of up to which they think to be at least 70,000 people. Now, in this change of administration in the state of Maine, there were a couple other enhancements that were made as well. Former Governor LePage had wanted very restrictive work requirements as their Medicaid program, but they had already gotten approval of a federal waiver to institute work requirements in Medicaid. The new governor, Governor Mills, rejected work requirements, that waiver, as soon as she took office as well. She has the right to do that. She talked with CMS and said, we are not going to implement work requirements in this state. So this is an example of a state that spoke to the people. They wanted Medicaid expansion. They also followed through on that, got the federal approval to do that, and they also looked at the current thinking on work requirements and said, no, federal judges have been striking work requirements out of Medicaid programs because the research is suggesting otherwise, that you can't penalize people for not working and therefore restrict them from their Medicaid. Instead, let people who are eligible enroll in Medicaid and then try to do some work promotion or other things to help support the families that need it. So you can read a little bit more about the state of Maine, that approval letter that came in from CMS in early April that says go ahead and expand Medicaid and capture all those people that should have been here since July 2018. If you have questions about Medicaid expansion, work requirements, or other topics, you can send us an email and you can find us at healthwatchwisconsin.org.